the land of Nelson Mandela, an eminent medical professional of South Africa, and especially Association of Pakistani Doctors of South Africa. When I look back almost 32 years ago, when I came to this country, I actually came from home, where I got my basic training as a doctor, to a new home, an enchanted but warmly welcoming place, where most of my colleagues, they actually specialized, and now they are serving the community. It makes me more humble and resolute to see the bridge, a connectedness and wishful vision where our roles in this global village are more demanding than ever. This gathering seems to me more meaningful and productive, where such a high-profile dignitaries of both countries are engaging to share the common grounds to develop skill and training for mutual benefit of ailing communities. May I request my guests, our guests, to please come on the stage and be seated so that we can start with the rest of the program. May I request Professor Shoaib Shafi, President of College of Physicians and Surgeons of South Africa, to please come up. Kashif. Professor Johan Fagon, President of College of Medicine of South Africa. Dr Khalid Mirza, he is President of Association of Pakistani Doctors in South Africa. Dr Akhtar Hussain. Dr Akhtar Hussain is not here. No. Mia Fahad Amjad, Acting High Commissioner for the High Commission of Pakistan here in South Africa. Dr Anjum Shehzad, he is Chairman of Association of Pakistani Doctors in South Africa. Now I will request Qari Hussain Qazi Sahib to come and do the recitation of Holy Quran. Qari Hussain.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. أفمن شرح الله صدره للإسلام فهو على نور من ربه فويل للقاسية قلوبهم من ذكر الله أولئك في ضلال مبين. الله نزل أحسن الحديث كتابا متشابها مثاني تقشعر منه جلود الذين يخشون ربهم ثم تلين جلودهم وقلوبهم إلى ذكر الله ذلك هدى الله يهدي به من يشاء ومن يضلل الله فما له من هاد. أفمن يتقي بوجهه سوء العذاب العذاب يوم القيامة وقيل للظالمين ذوقوا ما كنتم تكسبون كذب الذين من قبلهم فأتاهم العذاب من حيث لا يشعرون فأذاقهم الله الخزي في الحياة الدنيا ولعذاب الآخرة أكبر لو كانوا يعلمون ولقد ضربنا للناس في هذا القرآن من كل مثل لعلهم يتذكرون قرآنا عربيا غير ذي عوج لعلهم يتقون ضرب الله مثلا رجلا فيه شركاء متشاكسون ورجلا سلما لرجل هل يستويان مثلا الحمد لله بل أكثرهم لا يعلمون إنك ميت وإنهم ميتون ثم إنكم يوم القيامة عند ربكم تختصمون بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم اهدنا الصراط المستقيم اهدنا الصراط المستقيم اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين عليهم ولا الضالين عليهم ولا الضالين صدق الله الجبار العظيم.
Jazakallah Qari Hussain Sahib. May I request Maulana Ikhlaq Safi Sahib to please come for Naat Rasool Maqbool.
बिस्मिल्लाहिर्रहमानिर्रहीम। तमाम आशिकान मुस्तफ़ा और मुअज़्ज़ज़ मेहमानान गिरामी को अस्सलामु अलैकुम वरहमतुल्लाहि वबरकातुहू। मैं डॉक्टर खालिद मिर्ज़ा साहब और उनकी एसोसिएशन ऑफ फिजिशियन ऑफ डॉक्टर्स एसोसिएशन फिजिशियन ऑफ साउथ अफ्रीका जो है اور تمام جو ڈاکٹر حضرات اور میرے پیارے بھائی جو بیٹھے ہیں، سب کو محبت و مرا سلام. ایک بات میں نعت شریف پڑھنے سے پہلے شیئر کرنا چاہتا ہوں، اگر آپ اجازت دیں تو. فقہا لکھتے ہیں کہ جس بندے کو اللہ نے خوبصورت دل دیا ہے نا، وہ دل کی خوبصورتی کی وجہ سے سب سے محبت کرتا ہے، اور جس کو اللہ نے خوبصورت دل کے ساتھ خوبصورت زبان بھی عطا کر رکھی ہے تو پھر پوری دنیا اس سے محبت کرتی ہے. ایک سب سے بڑی مثال میرے اور آپ کے کریم آقا صلی اللہ علیہ وسلم حضرت محمد مصطفیٰ احمد مجتبیٰ کی ذات ببرکات ہے کہ اللہ نے آپ جیسا خیر البشر پیدا نہیں کیا، آپ جیسا خوبصورت، آپ جیسا صاحب کردار اللہ نے پیدا ہی نہیں کیا، اور آپ سے زیادہ میٹھی بولی اللہ نے کسی کی نہیں بنائی. اللہ مجھے اور آپ کو عمل کی توفیق عطا فرمائے. آمین ثم آمین. سینہ کھول کے درود شریف پڑھ لیجئے. صلی اللہ علیہ یا رسول اللہ وسلم علیک یا حبیب اللہ. ڈاکٹر خالد مرزا صاحب کے حکم پر یہ نعت شریف کے چند اشعار ہیں. اللہ کرے یہ جو شاعر نے ترجمانی کی ہے نا، یہ ترجمانی ساری بعد از خدا بزرگ تو ایک قصہ مختصر، اس میں چند اشعار ہیں جس میں شاید کچھ لوگ مغالطے کا شکار ہو جائیں. تو شاعر کا لکھنے کا مطلب ہے بعد از خدا. ذات خدا جو ہے وہ خالق و مخلوق ہے، اور نبی پاک صلی اللہ علیہ وسلم بہترین، یعنی آپ خالق ہیں، مالک ہیں، اور نبی پاک صلی اللہ علیہ وسلم بہترین مخلوق ہیں. ہاں لب پر نعت پاک کا نغمہ کل بھی تھا آج بھی ہے. لب پر نعت پاک کا نغمہ کل بھی تھا آج بھی ہے. میرے نبی سے میرا رشتہ کل بھی تھا آج بھی ہے. سینہ کھول کے پڑھ لینا. میرے نبی سے میرا رشتہ کل بھی تھا آج بھی ہے. پست کیسے وہ ہو سکتا ہے جس کو حق نے بلند کیا. پست کیسے وہ ہو سکتا ہے جس کو حق نے بلند کیا. دونوں جہاں میں ان کا چرچا کل بھی تھا آج بھی ہے. پڑھ لیں. میرے نبی سے میرا رشتہ کل بھی تھا آج بھی ہے. اور بڑا خوبصورت شعر ہے، کہہ دے سبحان اللہ، بلند آواز سے کہہ دے نا. یہ درود و دیوار جو ہے نا، یہ گواہی دیں گے معاشر والے دن کہ مولا یہ جتنے بھی ایگزیکٹو بیٹھے تھے نا، جب تیرے نبی کا نام آیا تو یہ ایگزیکٹونیس بھول گئے، تیرے نبی کی غلامی کو فخر کرتے رہے، اور تیرے نبی کا ذکر سن کے بلند آواز سے سبحان اللہ کے نعرے لگاتے رہے. نعت پاک کا نغمہ.
Thank you very much, Maulana Ikhlaq Sahib. Ladies and gentlemen, may I request Dr Kashif Mustafa to please come on the stage and give us a little bit of futuristic dimension of today's gathering. Dr. Kashif Mustafa.
Thank you, Dr. Burki. It would have been easier for me to talk about this rather philosophical topic if the result of today's match was different. I think everybody would have been more attentive to it. It's a difficult subject to get the grasp the philosophical aspect of medicine, but I'll try and make it quick and simplistic. Firstly, we must understand the theme of today's gathering is medicine. So people who are not medical professionals, please do excuse the medical jargons that we're going to use in this talk. The basic concept of today's meeting is that we've got the representatives or the chiefs of the two well-reputed regulatory bodies, one from Pakistan and one from South Africa, people who regulate the training of medical professions in their respective countries. And between these two colleges, which have probably come together to the best of my knowledge for the first time, the interdimensional cement or the bridge is the vast expanse of the medical professionals that sit here, the Pakistani doctors, that started coming to these shores probably in early 1990s. And ironically, maybe I should point out the vanguard of that entourage that landed on these shores was none else than Dr. Burki. He was probably the first one who came here, and then was followed by many people. Probably counts in hundreds now, and have a peculiar distinction, and that is that amongst all the people from different countries that came to South Africa to settle here, Pakistani doctors have done the most amount of post-graduation degrees, and now most of them 30 years later are at the pinnacle of their profession, may it be clinical practice, academia, research, whatever. Since the main concept of today's talk is to try and see what could be the collaborative effort between the two colleges that are present here on the stage. Now, there's nothing more pertinent to talk about medicine without going to its roots. And as we know, the roots of medicines go back to Hippocrates. And we all call him the father of medicine. We all take oath of Hippocrates. When we qualify, how much we follow, that's another thing, but that's what we do across the board. Now, why do we call Hippocrates the father of medicine? What did he do so special? Why was he given the abiding honor of being the father of medicine? And if I look back into history, I think there are three basic things. One thing is his definition of medicine, which he changed forever. And second thing was his two principles that he gave to the medical fraternity. His definition of medicine before Hippocrates, or before say 2,280 years ago, it was largely believed that all the diseases and the ailments are some kind of a supernatural phenomena. He was the first one to define that medicine does not have a supernatural component to it. It has got natural causes, which changed the course of human thinking, consciousness, research about medicine forever. So he took away that concept of superstition and all those misbeliefs, disbeliefs. And second, which probably are more, I think one implies more clinically and other more philosophically, is the concept of holistic practice of medicine. And the other one was altruism, selflessness in medicine. Now perhaps I should touch the holistic component first. Now if you go into the Aegean Sea, there's a little island called Kos, K-O-S, which is under Greek administration at the moment. This is where he came from. That was where he was born. That's where he practiced medicine. That's where he taught medicine, and that's where he died, and that's where he's buried. It's a little island, probably not more than 50 kilometers. So that's where medicine originated. And if you go to Kos Island now, there's still a tree there which is called Oak of Hippocrates, under which tree he sat and he started the practice of medicine, both teaching and clinical. And not far from there, maybe a kilometer away, is his hospital, the first hospital in the world, the Hippocrates Hospital. And when I had the privilege of going there, I was pleasantly surprised and perhaps a bit embarrassed as well at looking at the holistic approach that Hippocrates practiced in doing medicine. His hospital has got 3 levels. There's a ground level, there's a first level, and there's a second level. So when the patients would come to him from wherever they would come, he would treat them first on the first level, which was the ground floor, and he called it treatment of the body. Whichever herbs he had or whichever form of treatment that was available to him, bit surgical, he could train abscesses, and other was mainly obviously herbal. Once the person's body ailment was cured, he would not let the patient be discharged. He would take him to the first floor of his hospital, and there the second phase of his treatment would start, which is the treatment of the mind. And how did he treat the mind? He would put patient or let patient practice the hobby that they were naturally good at. So if somebody was good at poetry, he would encourage them to do poetry or painting or whatever. Once a person was completely connected to his natural capabilities mentally, then still he thought the patient is not cured. He would take patient to the third level, his second floor of his hospital, and there he would say the treatment of the soul. And that was, he would reconnect the person to the belief system that the patient was naturally or inclined to practice from the childhood. At that time, obviously, it was mainly polytheism or paganistic, but whatever belief system. Once he had connected all 3 dots, he treated the body ailment, he's corrected the mind, and he's reconnected the soul, he would say another patient is cured. And then he would let the patient go. And I think that's one approach of Hippocrates that we as a clinicians, we have all forgotten. We just treat the body, and we forget about the 2 other extremely important components of human existence, which are the mind and the soul. And the second aspect of Hippocrates' practice of medicine was altruism. Altruism, as we know, the concept of selflessness. So as Hippocrates became extremely popular and successful in his practice of medicine, he had students and patients from all over the world. I mean, world in that time means basically the Egyptian civilization, Indian subcontinent, and he would get students, he would teach them, he would train them, and he would then send them back to wherever they came from. But he would always give them one advice, which is incorporated into his Oath of Hippocrates, and that was that if diseases do not know boundaries, then why do doctors should observe boundaries? And over the years, we have seen this concept of Hippocrates' holistic approach and altruism coming true again and again and again. Diseases, pandemics, may it be metabolic, infectious, Spanish flu, Hong Kong flu, Indian flu, COVID, shows us that diseases do not respect boundaries. So the doctors also should not respect boundaries. Hippocrates says that medicine cannot be practiced without collaboration and reciprocity. And this is why we here between the 2 colleges to establish that concept of collaboration and reciprocity. We as doctors in South Africa, Pakistani physicians sitting here, we have had roots in Pakistan and we have spent fair amount of our life here in South Africa. We know the commonalities that exist between the 2 countries, how much we can mutually benefit. One of the principles, a binding principle of reciprocity is, number 1, there should be a fair exchange, there should be fair expectations, and there should not be an unfair expectation that one would receive more than the other. The 2 parties that are involved in the reciprocity should always be willing to give more than rather receive more. And that is the only principle in which reciprocity works and is successful. That's all I had to say, but having said that, before I conclude, 32 years, most of us being here, I think we have passed many obstacles in our life. We are well settled into our professionals, into our careers, and most of us are probably looking into the retirement, but 32 years later, there are new challenges with our presence here in terms of medical profession, our posterity, the next generation, the progeny has come up. And that is equally important for us to address, and I'm glad to address that. We have the representative of the 2 colleges here, and let this be possibly the first drop that will start a collaborative process of reciprocity. That I would like to invite A person that does not, in fact, need any introduction, but I think being on the stage and a mic in front of you, you have to say something. So, but we all know him well. Does not, as I said, does not need any introduction. He's the president of the Pakistani Doctors Association of South Africa. He's the overseas representative of the government of Pakistan in Africa. He's the director of trauma at Garden City Mill Park. And my dear friend, Dr. Khalid Mirza.
Bismillahir Rahmanir Rahim. I'm deeply humbled and honored to host this historic evening where over the history of Pakistani doctors in South Africa over almost 32 years, we have the delegation from the highest authority in Pakistan, College of Physicians and Surgeons of Pakistan. I would like to convey my sincere gratitude and a very warm welcome to Excellency Professor Shoaib Shafi Sahab, the President of College of Physicians and Surgeons of Pakistan, and his entire delegation. I'm also grateful to Professor Johan Fagon, who is currently President of College of Medicine of South Africa, and who has kindly graced us by his presence this evening. On behalf of Association of Pakistani Physicians of South Africa and hundreds and thousands of overseas Pakistanis living in all 54 countries of African continent, I'm thankful to each and every one of you who is here today to witness and to grace this occasion. Professor Shoaib Shafi Sahab has been our teacher, and for any student, there can be no honor bigger than this one, that he is standing on the stage and it is being witnessed by his own teacher. Sir, we thank you. Professor Shoaib Shafi Sahab, we know him since late 80s, and I'm privileged to have known Johan Fagon since 1992. It was that time during apartheid era when I went to practice medicine as a registrar or a trainee at Kruger Hospital at University of Cape Town, and our association with Professor Fagon goes back to more than 20 years. I would like to take this opportunity to convey certain concerns that Pakistani doctors and Pakistani overseas community in South Africa that do have, and I would like to request Honorable Shoaib Shafi Sahab to give a thought how best Pakistan can accommodate its own children who have taken a new home in South Africa. Sir, the fellowship degree of College of Medicine is recognized in all first world countries, including UK, Canada, Australia, New Zealand, Ireland, and I see no reason why a specialist who has got fellowship degree from South Africa should not be able to practice medicine in Pakistan. The second issue that we have got is that because of quota system in this country, our children who get very high grades, but in spite of having obtained high grades, are not able to get admission into medical schools because they belong to certain skin color. Unfortunately, the history of South Africa, you can't dissociate from apartheid era. And during that time, there were hundreds and thousands of South Africans who went to study medicine in Pakistan. And now I would like to request Pakistan again that, sir, would you be kind enough to accommodate, to own your own children and accommodate them in medical schools in Pakistan? The third issue that our children are facing in this country, that they do become doctors, they do have a degree in medicine, but there are very limited opportunities for them for post-graduation. Again, I consider Pakistan still my home. We belong to Pakistan. This is our second home. And I would like to request Excellency Shoaib Shafi that between the two colleges, if we can have some kind of program that College of Physicians and Surgeons of Pakistan could accommodate the graduates of Pakistani origin or South Africans who are in this country and would like to do postgrad training in Pakistan. I know that you have been waiting for a long time. With these words, I would like to again say thank you to all of you and thank you for being here this evening. Thank you.
Thank you, Dr. Mirza. We need to take this discussion further, and I think there is no other better person than to take this discussion further. May I request Professor Johan Fagon, President of the College of Medicine, South Africa, to give us his thoughts. Thank you, Professor.
Right, thank you very much. And firstly, it's a tremendous honor for me to be here. And I'd like to, and it's also been a wonderful opportunity for me to re-establish ties with my colleague from Kurdish days it's about 30 years ago. And as you know, I'm the president of the Colleges of Medicine of South Africa, and I know that many of you have been involved in the college directly as teachers of the registrars that are being examined in the college, and also as examiners, and we're greatly appreciative and therefore the role that the Pakistani community of doctors have played in terms of building and strengthening healthcare in this country. And I'm also extremely pleased that the Pakistan College of Physicians and Surgeons has taken the initiative to engage with us and to come to South Africa with a big group of colleagues, because we forget sometimes that 80% of the world's population lives in developing countries. And the experts in terms of how to deliver healthcare and to educate our healthcare practitioners in most of the world is not in North America and it's not in Europe. It's in developing countries, and so it's so important that we build these South-South collaborations between educationists and medical practitioners and academics in developing countries, because that's where we're going to find the answers to our problems. Because we best understand the limitations of practicing in limited resource settings. We best understand the challenges, but also the solutions, and so that's why we look forward to working closely with you over the next 3 days to explore the commonalities which has been mentioned earlier, but also how we can learn from your experiences and to strengthen both your and our training programs in the process. And so thank you very much for coming out, Professor Shafi, and your delegation. Just to respond to some of the so very direct comments about the difficulties that we face practicing in this country, especially with the transformation processes which are going on. It is a difficult time in this country. We had to undergo some period of redress. The question is how to do this fairly, and there's always going to be groups that are going to be excluded. Now, in 1994, of course, using race as a proxy for disadvantage was a fair way to do it because all people of color were disadvantaged, including the Pakistani community in this country. But the question is, how long should this persist for? Are there better tools to measure disadvantage? And at this point in our history, with a big black middle class that has evolved, well, the question is, aren't there more precise tools to measure disadvantage than purely race? And I think that's what you were probably alluding to. And it's important that we as doctors stand up to these issues. When it comes to recruitment of registrars into teaching hospitals, we have to stand up when normal labour or correct labour practices aren't being followed. And when it comes to appointment of consultants in teaching hospitals, we should also stand up to government and point out when the correct recruitment processes aren't being followed. But most certainly, so your suggestion, that we engage more with our Pakistan training institutions to be able to extend training for the Pakistani young doctors in Pakistan and hopefully to return to this country, I think that's a wonderful suggestion. So just to conclude, once again, thank you very much for this wonderful opportunity, and welcome to our guests from Pakistan. And I look forward to visiting your country in January and in February, when I'll be teaching on a course in Islamabad as well. And I look forward to the next 3 days. It's going to be really interesting, and I look forward to learning from you. Thank you so much.
Thank you, Professor Fagon. May I request now Mr. Shoaib Shafi Sahib to please come and enlighten us, that is, with his thoughts and his vision. Professor Shafi Sahib.
Bismillahirrahim. Allahumma salli ala Muhammad wa ala ali Muhammad wa barik wa sallim. First of all, I am really grateful to Dr. Khalid Mirza, my student, and all the doctors and non-doctors who are here to give us such a really warm welcome from their heart. I am really obliged. And Professor Fagon also, the president of the College of South Africa, who is here. And in the coming 2 to 3 days, we are having a lot of discussion with the college about expansion of our 2 postgraduate programs. I was just listening to your speech about the various type of collaborations which you expect, and I think there's a lot of space which we can expand. I think historically Pakistan and South Africa, they are fairly common. They have got common history. There was politically, I think the same thing happened here. I don't want to go into detail, but we also got independence in 1947, and since at that time there were very, very, very few even graduate doctors. The Britishers, when left the India and Pakistan, there was only one medical college, that was King Edward Medical College, now a university, and we have got with us Professor Khalid Mirza, who is in my delegation, and Professor Amir Zaman. They both have been the vice chancellors of this King Edward Medical University now. So at that time, there was only one medical college in Pakistan. There were very few graduates, and the country could not think of having their own postgraduates. And most of the doctors in Pakistan who graduated from this college, they went to West to do post-graduation, but unluckily, mostly they never returned back to Pakistan. So Pakistan was losing whatever it had, the potential of expert doctors. So in 1962, a fatherly figure, a legend, the first president of the College of Physician Surgeons, Lieutenant General Wajid Burki, may Allah rest his soul in peace in Jannah. He came forward and he established this College of Physician Surgeons Pakistan. And with the help of about 50, if I'm not wrong, 50 specialist doctors, and that time from both East and West Pakistan. So, but the first fellow of our college was produced in late 60s, I think 68 or 69. And at that time, the government of the provincial governments and the federal government, they were not eager and keen, and they were not accepting the existence of specialists. So gradually the college, because it was formed by the Act of Parliament, and still it enjoys the autonomy by our government. We have got financial autonomy, we have got our independent decision making autonomy. So the college existed, and Alhamdulillah now, humbly I can say that I am representing 35,000 specialist consultants of the country, 12,000 plus members who are members, and about more than 40,000 postgraduate trainees. So about almost 1,100,000 doctors, this delegation which has come with me, they are representing that part of the. But if you see the whole population of Pakistan, this is nothing. This is nothing. So with this period, in this last 60 years, we have been able to expand from 3 specializations we started. Now we are doing specialization in 79 various disciplines. 79. That is the total number of specialties which we are dealing with. So now coming to the collaboration between our sister South African College, the present delegation which is with me, mostly they are consuls since last more than 15 years. There are some new consuls also, but mostly consuls which have come with me. We are in the council of this qualification since last 15-16 years. And we have been developing various collaboration between different sister colleges, sister countries. We have got close collaboration between Nepal, Saudi Arabia, UAE, Kuwait, UK and Ireland. And these are the countries where we have got close interactive collaborations. We have got exchange programs, and in these countries our degree is accepted, and people who do our fellowship, they can go to those countries and they can appear in their examination as well. So coming to the area of collaboration between our two sister colleges, I think there is an immense area where we can collaborate. In the coming 2-3 days, I think discussion will go along to these different fronts. Exchange between the examination system, exchange between the training systems, exchange between the process of accreditation which we are doing, and exchange between our trainees also. Because I can very confidently say to the President of the Royal College and to the doctors here that we have got ample quantity in our country where we can train. So trainees of South African doing post-graduation, they can come to Pakistan as well to practice and to learn from here, because we have got a very vast population, especially in surgical skills. Your trainees can come and they can learn a lot of surgical, improving the surgical skills in our country. And I think that should be a two-way process. In the coming days, we will be discussing on these different topics. And I think the trainees from our country, they can come to South Africa, and South African trainees, they can come to Pakistan. But in some areas, we have super specializations. Like there are many branches, I won't go into detail, but like in vascular surgery or hepatic transplant surgery, we have got some ideal institutes in our country where a lot of liver transplantation is being done, and you will be happy to know that that is being done free of cost. So our government has supported in many areas, and there are various NGOs which have come forward, and a lot of good institutes have come where our students, they are doing fellowships and they are serving the people. So your trainees, they are always welcome to there. We always develop a collaborative type of system where your training is coming and likewise to it. We will be inviting you for examinations in our different examinations, and in coming days we are going to discuss that in 365 days of the year, in 285 days we are having examinations. So lot of area where your examiners can come, whatever the your college will nominate, you can invite them and they will be seeing our system of examination, and we can, I think mutually we can learn a lot. College of Physicians in Pakistan is a progressive body, and in this year, January, I went myself with the Pakistan government officials to Afghanistan. Afghanistan is again a country which needs a lot of help. And I am so happy that when I see that a lot of doctors, my students, and after that also, they came from Pakistan to serve this South Africa. And a lot of doctors of Pakistani origin, now they are South African. So we can easily say that these two are sister countries. So the Pakistani doctors, they have served a lot in this country. Because at that time, I think in the early 90s or late 80s, this country needed a lot of doctors. So Pakistan was there to come forward in this work. Likewise, our college field surgeons often has offered services to Afghanistan government, Afghanistan health department, and soon when I go back, we are having a signing official documents that we will be having collaborative cooperation between Afghanistan and Pakistan. Afghanistan soon will be coming to Pakistan to get training from our country. So we are already expanding. About the England and Ireland, I've got with me Professor Askar Sahab, he is Director of International Relations. First, Professor Bondal, who is now Senior Vice President, he was our DG of IR. How they established the collaboration between England and Ireland. And now, Alhamdulillah, 100% of the students of college field surgeon who go to Ireland or UK, they do come back to Pakistan. They do come back and they serve our own country. So we have got various type of schemes. I think that the coming days we discuss with you. We definitely share your experience. About what you were saying about the doctors who have done graduation or post-graduation in South Africa, how they can be accommodated in Pakistan. Actually, I just want to make one thing very clear, that CPSC is a regulatory body for post-graduation. For graduation, we have got another body which is known as Pakistan Medical and Dental Council. That is their prerogative which gives the equivalence to all the international graduate and postgraduate degrees or diplomas. So that thing can be taken on that front. But now in the PM Pakistan Medical Dental Council, our college has nominated Professor Khalid Mirza as a permanent rep of CPSB into the PMBC Medical Council. And I am also a member of that council also. So in future, whenever any case of equivalence comes to the PMBC, we will be definitely supporting that area also. Your recognition. Now coming to the post-graduation, I think we can definitely develop, we will have been meeting with the President, different strategies, how we can collaborate about the post-graduation of the two countries. Because in UK and Ireland, there are many colleges which recognize our fellowships. Our students, they go to UK and Ireland, they directly appear in their Part 2 examination. I think this type of system can be developed, or may be developed between South African College of Medicine and College of Surgery in Pakistan, so that the Part 1 or initial things may be exempted and the training can be equalized, and then they can appear in the exit examination. But that will be a two-way understanding if we somehow develop that type of. For that we will be needing some discussion, and I got a very strong team with me, and we have got a council of 20 council from all over Pakistan. So whatever policy decision we take jointly with the collective wisdom. So I think that thing will be definitely in the agenda and we will discuss that. And in the end, I am again really very grateful to President and all the doctors who have invited me. I have once come to this country, this very beautiful country. I have come, I think, 1999 or 2000. I went to Kurukul National Park. It's a great park over here. And then I went to Port Elizabeth, but I did not visit Cape Town. So this time we hope to visit Cape Town also. And I'm really very glad again to share my views with you. And I am again grateful for giving us the honor. Thank you very much.